Preface. The present book emerges from a clinical observation that is simultaneously simple and profound. The individuals who fill the waiting rooms of cosmetic dermatologists and beauticians across the world are not, in most cases, people with genuine medical conditions requiring dermatological intervention. They are people who are afraid of being unattractive, afraid of becoming unattractive, afraid of the social rejection, professional disadvantage, intimate failure, and personal worthlessness that their cultural environment has taught them to associate with the failure to meet beauty standards that are, by design, unachievable. This fear, which is persistent, excessive, clinically significant, is charismaphobia, and this book is its clinical response. Chapter 1 establishes the world in which charismaphobia develops and thrives. Beauty is not a trivial concern. It is a psychosocial reality with measurable consequences for social recognition, professional outcomes, intimate relationships, and psychological well-being across cultures and throughout history. The cosmetic industry that has grown around this reality is economically enormous and psychologically consequential, sustaining itself not by delivering genuine beauty, but by sustaining the fear of its absence. Within this landscape, psychodermatology has begun to document the bidirectional relationship between psychological distress and dermatological conditions, establishing that the skin is not merely a biological organ, but a psychosocial surface on which cultural expectations, personal anxieties, and identity struggles are expressed and managed. Against this backdrop, the chapter introduces charismaphobia as the primary psychosocial condition driving appearance management and cosmetic use, establishes the foundational clinical distinction between legitimate cosmetic use and charismaphobia-driven cosmetic dependency, and introduces charismatherapy as the therapeutic framework designed to address it. Chapter 2 builds the theoretical architecture that explains charismaphobia across the full range of psychological scholarship. 7 theoretical traditions are brought to bear on the condition. The psychodynamic tradition explains how cosmetic dependency functions as a neurotic symptom maintained by temporary anxiety reduction rather than genuine resolution. The behavioral tradition identifies the negative reinforcement cycle through which compulsive cosmetic behavior is sustained and escalated. The cognitive tradition names the specific distortions through which cultural beauty pressure becomes clinical personal anxiety. The sociocultural tradition reveals how beauty standards are constructed, enforced, and internalized at the collective level through the mechanisms of impression management, social identity, and social comparison. The humanistic tradition articulates the deficiency motivation and conditions of worth that make charismaphobic cosmetic dependency psychologically self-defeating. The positive psychological tradition specifies what genuine flourishing looks like as the therapeutic destination that charismaphobia systematically forecloses. And the feminist tradition exposes the political and commercial architecture through which beauty standards are generated and sustained as instruments of social control and commercial profit. Together, these frameworks establish charismaphobia as a condition of remarkable theoretical depth, whose comprehensive understanding requires precisely the kind of integrative, multi-theoretical analysis that this chapter provides. Chapter 3 translates this theoretical foundation into clinical reality. Charismaphobia is formally defined as the fear of unattractiveness and differentiated into 2 subtypes. The fear of being unattractive, which generates present-oriented cosmetic behavior in the treatment zone, and the fear of getting unattractive, which generates future-oriented anti-aging behavior in the prevention zone. Its 8 clinical symptoms are specified, 2 of which are mandatory for diagnosis: anxious thoughts about being regarded as unattractive by others, and the taking of medically unjustified measures to get or stay attractive. The social recognition criterion that distinguishes charismaphobia from body dysmorphic disorder is articulated, and the charismaphobia scale is presented with its 4 empirically confirmed factors of self-exhibition, narcissistic trends, media consumption, and charismaphobic anxiety. And its excellent reliability and highly significant convergent validity with generalized anxiety disorder, obsessive-compulsive disorder, and narcissistic personality disorder. The chapter establishes that charismaphobia is not a theoretical construct that resists measurement, but a psychological reality that can be reliably assessed, meaningfully differentiated from related conditions, and tracked as an outcome across clinical interventions, and that it is precisely identifiable as the primary psychosocial determinant of appearance management and cosmetic use. Chapter 4 introduces charismatherapy, the clinical intervention that has made the identification, measurement, and theoretical understanding of charismaphobia possible and necessary. The chapter first establishes the clinical gap that charismatherapy fills, the structural absence of a named, theoretically grounded psychotherapy specifically designed for charismaphobia in the cosmetic practice contexts where charismaphobic individuals are most frequently encountered. It then positions charismatherapy in relation to existing therapeutic approaches, demonstrating that while cognitive behavioral therapy, exposure and response prevention, acceptance and commitment therapy, and standard psychodynamic therapy each address important dimensions of appearance-related distress, none provides the charismaphobia-specific psychoeducational content, the beauty-to-attraction conceptual reframe, the clinically original unique feature identification technique, and the self-contained delivery format that charismaphobia treatment requires. The 5 phases of charismatherapy are then presented as a clinically integrated and sequentially necessary therapeutic arc. Charismaphobia assessment calibrates the intervention to the client's specific profile and zone positioning. Beauty perception education dismantles the cultural and commercial architecture of the beauty standards generating their anxiety. Attraction reframing replaces beauty as an evaluative standard with the age-independent, culturally inclusive, and universally achievable concept of holistic attraction. Unique feature identification reverses the charismaphobic pattern of selective abstraction by identifying and celebrating each client's distinctive physical attributes. And holistic attraction development expands the client's self-evaluative framework to encompass emotional expressions, values, habits, and human aura as cosmetically independent sources of genuine and durable attraction. Chapter 5 examines the implications of the charismaphobia framework and charismatherapy for practitioners and the cosmetic industry. For the cosmetic industry, the chapter presents both a critique of current practices, establishing that the industry's commercial infrastructure is structurally dependent on the generation and temporary relief of charismaphobic anxiety, and a constructive alternative model organized around authentic self-expression and genuine consumer value rather than the exploitation of the fear of unattractiveness. For cosmetic dermatologists and beauticians, the chapter specifies the concrete practice changes that the charismaphobia framework requires, including the integration of charismaphobia screening into the clinical assessment pathway, the expansion of informed consent to include the psychological risks of procedure seeking motivated by charismaphobic anxiety, and the development of referral pathways to charismatherapy for clients whose treatment seeking is psychologically rather than medically driven. The chapter closes with limitations and future research direction sections that identify the specific empirical gaps future research must address. The foundational aphorism of charismatherapy, beauty is to feel beautiful, captures in 5 words the clinical philosophy that animates every page of this book. Beauty is not a standard to be met, a procedure to be performed, or a product to be applied. It is an internal experience to be cultivated, a subjective sense of confidence, authentic self-expression, and genuine attraction that is available to every person regardless of skin tone, body shape, age, or cultural background, and that no cosmetic intervention can manufacture and no aging process can take away. This book is written in the conviction that understanding this truth clinically, measuring its absence precisely, and delivering its cultivation therapeutically is among the most meaningful contributions that contemporary psychology can make to human well-being, and that charismaphobia, charismatherapy, and the research directions they initiate are the beginning of that contribution. Waqar Hussain,